Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Welcome to Your Spine. I'm Dr. Fryer, and this is all about your spine, your health. In the previous episode, Dr. Armitage talked about L2. As we move down the spine, the next vertebrae is L3. This one is associated with L2 above it and L4 below it. Today we are going to be talking about disc herniation. In order to understand what a disc herniation is, one needs to know a little of the anatomy of a disc. If we cross-section the spine at L3 level, you can see the intervertebral disc is sandwiched between two vertebrae. This is a side profile with your stomach facing left and your back to the right. These in-between structures make up about a third of the total height in the spine and are very important in reducing shock with load. They are made up of two main structures. One, the nucleus, which is red in this picture for demonstration purposes, and is in the form of mostly water. And two, the annulus, made up of several tough outer concentric rings, which are supposed to contain the nucleus in the middle. But in certain circumstances, these outer rings break from the inside out, and the nucleus can squeeze out through a breach called an annular tear. Once the nucleus passes all the way through the outermost ring, it is called a herniation. And the problem with a herniation is that it can compress delicate nerve roots. This often creates back and leg pain. We know herniated discs are twice as common in men compared to women, and we usually see them in between the ages of 30 and 50. Most herniated discs occur at the lower lumbar spine at L4-5, but we also see them elsewhere in the spine, including the neck, and not so common in the mid-back. Some of the risk factors associated with lumbar disc herniation include smoking, weight-bearing sports, repeated lifting, as well as driving a motor vehicle. As you can see here, the best way to get a disc herniation is to lift while bending the spine forward. So what can you do to prevent a disc herniation? Well, the single most important thing is posture. Keep your back in lordosis when you lift, bend, or sit. We know now from science that flexion loading, or bending forward, especially with load, causes the nucleus to push backwards towards those delicate nerves. Staying active always helps, but be mindful that you are not increasing your risk for disc herniation. For more information on the topics we have discussed today, be sure to contact your family chiropractor. Remember, your back is important to your daily health. Join us on the next show as we continue our journey down the spine.